Hi from Buddy and me. April is Bowel Cancer Awareness Month in Ireland, so let's chat through screening and also the symptoms of bowel cancer. It's the second most common cancer in Ireland in men and the third most common in women. And success rates from treatment are extremely high if you pick it up early. But we know about half of cases are not picked up early and the success rates are not as good. So we want to look at screening people who have no symptoms at all, and then early detection for people with symptoms. The screening is for people with no symptoms at all between the ages of 58 and 69, and you register with the HSE and you get sent a little home kit that tests home samples of poo. You send off the kit and you get an answer back. And if that test has picked up hidden blood in the bowel motions, you get invited for a colonoscopy. The other then is if somebody has symptoms, and this can happen in a younger age group than the screening age groups. So always be careful if you have symptoms. We're looking out for unexplained weight loss, for abdominal pain or bloating, for iron deficiency anemia, for a change in bowel habit. So if you're getting constipation or diarrhea that's unusual for you over a period of at least a month, do seek attention. And then some people will pass blood in their bowel motions. Now, most people who pass blood don't have bowel cancer, but if you have symptoms or if you have a strong family history of bowel cancer, then do get advice from your GP. The screening test then, the gold standard is colonoscopy. I had a test yesterday. I'm 60. The prep was probably the worst part of it, but the procedure itself was very straightforward. So I'll run through it and hopefully give you some tips if you're considering that or scheduled for one. The biggest part of the colonoscopy is the prep of the bowel. So it needs to be completely clean and empty. And there are various medicines to do that. I got this one called Citrafleet. It's not pleasant. Depending on the time of day your procedure is, you take a sachet with about a quarter litre of water. You stay really hydrated with isotonic drinks. And then you get a really quick, over a couple of hours, you get a really quick evacuation or emptying of the bowels. That's not nice. You don't have a ton of control over that, so you really need to stay near a toilet, but it's completely pain-free. Then you take the second sachet, which is really clearing any residual matter from the bowel, and you again stay hydrated. You'll get instructions on when to stop eating or drinking, and then you'll go in and have your test. You have it done under sedation. So I had a little drip on the back of my hand and I got some sedative. I was breathing completely on my own. The procedure was very quick. I don't remember the procedure. I was sedated, but it was not uncomfortable at all. And then when you come around a short while later, you get that magical tea and toast. That feels great. I didn't feel any tiredness or any kind of hangover effect from the sedation. Felt absolutely fine. And I got my result there and then. And for me, the result was clear. I had a little tiny hemorrhoid inside the bottom part of the bowel that looks like it may have bled a tiny bit. So that was giving me the false positive on the fecal test. Thankfully, that was fine. But we're looking for polyps or little growths that stick out into the lining of the bowel, because some of these over a number of years can turn suspicious and show changes. So the bottom line, if you'll pardon the pun, is if you have any symptoms, go and get checked. It's not embarrassing, it's just safety, and we have an incidence of bowel cancer in Ireland that is rising, so do get checked if you're worried. And the second is, if you're in that age range of 58 to 69, you can register with a home kit, or you can buy these privately in pharmacies as well. So stay as safe as you can. Bye from Buddy and me. Take care.